Hi, my name is Robert Chelle with Chelle Law, and my law firm assists dental associates with employment contract and independent contractor agreement issues. Today I'm going to talk about whether a dental associate should notify their patients when they leave a practice. So this is a tricky one, and it's going to be dictated by what's called a non-solicitation agreement. I'm going to assume that you have signed either an employment agreement or independent contractor agreement that includes a non-solicitation clause or agreement, however you want to refer to it. And let's just kind of talk about what that will prevent you from doing. Most of the time, a non-solicit will stop you from actively soliciting a patient. They'll usually have another one for employees as well, usually for a year or maybe two. You cannot actively solicit them, so meaning you cannot initiate contact. So if a dental associate decides to leave the practice and they give whatever the required notice is, you would essentially be prohibited blasting out an email, sending out a group text message, sending a mailer that lets any of your patients know that you're leaving the current practice and where you're moving, or that you'd like them to come with you. That would all be prohibited in a standard non-solicitation clause. So if anyone is going to let your patients know that you're leaving the practice, most of the time it would be up to the practice of whether they let your patients know or not. Really, even though the dental associate may be the sole provider of dental care for a patient, if you're an employee, the patient is a member of the employer, not a patient of the dentist, if that makes sense. Now, any patient can kind of decide who their provider is. So most of the time, the clinic would not prohibit the dental associate from providing care to anyone that they had in the past, although I have seen non-solicits that include that. Most states want anyone to have kind of the choice of who their healthcare provider is, keeping in mind that an employer is allowed to protect their business interests through a non-compete or a non-solicit. So if you are a dental associate leaving a practice, don't download all your patients and blast out an email to them. That could, get you in hot water eventually. Now, obviously, people want to know, all right, well, what is considered solicitation? What if they contact me? What should I say? Well, it's going to depend upon how solicitation is defined in the agreement. But for the most part, if the patient is the one that initiates contact and says, hey, Dr. Smith, I hear you're leaving the practice. I'd love to come with you, or, know where you're going. In that scenario, you're not the one initiating contact, and it's okay to respond and let the patient know. But once again, any kind of active pursuit of patients would be prohibited in most non-solicitation agreements. Now, even further, the questions I get are, well, what about if I, create a Facebook page, or just mail, send out a general mailer to the population, close to the practice, or start some kind of Google ads. Once again, you got to go to the language of the contract and see if that type of thing is prohibited. Generally I find that just kind of general advertisement, not actively soliciting one specific pocket of people, would not be considered active solicitation. Just general marketing would be okay. But there, once again, are some solicitation clauses that say that specifically you cannot actively market within the area, through this, mode, that type of thing. So just read over the agreement carefully, see what's prohibited, and just make sure that you're avoiding that kind of conduct. So if you have any questions about your employment agreement or independent contractor agreement, feel free to reach out to my law firm at the contact information listed below in the description. And if you have any questions, I'm happy to answer them. All right, take care.